the anatomical position of occipital bone. The external surface is convex, the internal surface is concave. The basi-occiput, the basilar part of occipital bone, is directed forward and upward. And the two condylar part are directed downward. Now we'll talk about the squamous part of occipital bone. It has two surfaces, external surface, internal surface, three angles, one superior angle, two lateral angles. These are the two lateral angles, and four borders, two superolateral and two inferolateral. This is the external surface of squamous part of occipital bone. This is external occipital protuberance. The highest point of it's called Inion. This is Inion. And this is external occipital crest, which extends from the Inion up to Foramen Magnum. This is high. There are three nuchal lines which passes laterally. This is the highest nuchal line. This is the superior nuchal line, and midway from the external occipital crest, this is inferior nuchal line. Now I will show you the muscle attachments. The highest nuchal line medially gives attachment to gala aponeurotica or epicranial aponeurosis, and laterally to the occipital belly of occipitofrontalis. The superior nuchal line medially gives attachment to trapezius and laterally to sternocleidomastoid. Then this is the inferior nuchal line, this is the superior nuchal line. This middle space gives attachment to three muscles. Medially, this is the semispinalis capitis. Laterally, just below sternocleidomastoid. This is the semispinalis splenius capitis. And below the splenius capitis and above inferior nuchal line, this is the superior oblique capitis. So this is semispinalis capitis, splenius capitis, superior oblique capitis. And below inferior nuchal line to the foramen magnum, there are some muscles. This is the rectus capitis posterior minor and rectus capitis posterior major. This is rectus capitis posterior minor, rectus capitis posterior major. This is the internal surface of a squamous part of occipital bone. This is the internal occipital protuberance. This is internal occipital crest, which extends from the internal occipital protuberance to the foramen magnum. This is superior sagittal sulcus, and there are two transverse sulcus, one to the right, one to the left. This is right lateral transverse sulcus. This is left transverse sulcus. The superior sagittal sulcus plonges superior sagittal sinus and gives attachment to falx cerebri. These edges gives attachment to falx cerebri. The transverse sulcus lodges transverse sinus, and the edges gives attachment to tentorium cerebelli. The internal occipital crest lodges occipital sinus, and these edges provides attachment to falx cerebri. This is internal occipital crest protuberance. This is internal occipital protuberance, which is also called confluence of sinus, because the terminal part of superior sagittal sinus and the true transverse sinus and occipital sinus all meets at this point. So this is called the confluence of sinus or meeting point of sinuses. There are two fossas, there are two superior fossas, there are two inferior fossa. The superior fossa are triangular in shape, then the inferior fossa are quadrilateral in shape. The superior fossa accommodates occipital lobes, and the inferior fossa accommodates cerebral hemispheres. Now we'll talk about the basilar part of occipital bone. It has three surfaces and two borders. This is superior surface, this is the anterior surface, and this is the inferior surface. and these are the two lateral borders. The anterior surface forms a joint with the sphenoid bone. This is the sphenoid bone. This forms a joint. This is the primary cartilaginous joint. This forms a primary cartilaginous joint. This is the primary cartilaginous joint, and this sloping area, this wait, let me show you the joint. This sloping area, is called clevus, and this supports the pons and medulla oblongata. And there are some basilar artery. There is a basilar artery and its branches and basilar plexus of veins around it. The clevus gives attachment to three ligaments from upward to downward. Membrana tectoria, which is the upper continuation of posterior longitudinal ligament. The membrana tectoria, then upper band of cruciate ligament, and the third is apical ligament of dens. So these are the three from upward to downwards: membrana tectoria, upper band of cruciate ligament, apical ligament of dens. And this is the inferior surface. This is the inferior surface of basic occiput. So there is in the middle, this is the pharyngeal tubercle, which gives attachment to pharyngeal raphe, which is the pharyngeal raphe is the fusion of posterior fibers of superior constrictor, middle constrictor, and inferior constrictor muscles of pharynx. Then just beside the pharyngeal tubercle, these are the two depressed areas. This provides attachment to longus capitis muscle, and there are also two lateral depressed areas just in front of condylar part. This gives attachment to rectus capitis anterior. So this is longus capitis and this is rectus capitis anterior. And from the pharyngeal tubercle, from behind forward, there are three fascia. This is prevertebral fascia, buccopharyngeal fascia, and pharyngobasilar fascia. Now there are the remaining two lateral borders, which articulates with the petrous part of temporal bone. We can see in the articulated skull. This is the attachment. This is the attachment of the lateral borders with the petrous part of squamous, petrous part of temporal bone, and this line, there lodges inferior petrosal sinus, which drains into the internal jugular vein. This is the lateral border, articulates with the petrous part of temporal bone, and this sulcus lodges inferior petrosal sinus, which drains into the internal jugular vein. This is the jugular foramen. Now we'll talk about the condylar parts. This is the occipital condyle. This is occipital condyle. There are two occipital condyle and jugular process. These two are collectively called the condylar part of occipital bone. These occipital condyles are elliptical in shape and forms joint with the atlas. The joint is ellipsoid type of joint. There are two jugular processes. These are the two jugular processes beside the occipital condyles. The jugular process has a notch. The jugular process has a notch. This is the notch, and superior surface and inferior surface. We'll talk about an important foramen magnum, which is divided into two compartments by alar ligament. This is the attachment of alar ligament from the medial portion of two condyles, alar ligament. The anterior small compartment is also called osteoligamentous, and posterior larger compartment is called neurovascular compartment. The anterior margin of this foramen gives attachment to anterior atlanto-occipital membrane, and the posterior margin gives attachment to posterior atlanto-occipital membrane. The anterior small compartment, this compartment passes structures from below upwards are apical ligament, upper band of cruciate ligament, and membrana tectoria. The posterior larger or neurovascular compartment, in this compartment some structure passes from above downwards and some from below upwards. The structure which passes from above downwards are lower end of medulla oblongata with its meninges, one anterior and two posterior spinal arteries, veins joining venous plexus of medulla oblongata with the vertebral venous plexus of veins, and lower part of tonsil of cerebellum. This structure passes from above downwards. Now we'll see which structure passes from below upwards. These are right and left vertebral arteries and plexus of sympathetic nerves and spinal root of accessory nerve.